Autism. Is it a disorder that needs treatment? A disability that requires accommodations? Or is it simply a different way of being in the world? Hi everyone, I'm Dr. Chris Palmer, and today we're exploring one of the most debated questions in both medicine and the autistic community. Autism is complex. Its challenges are undeniable, but so are its unique strengths. Let's unpack what we know, and more importantly, how we can approach this condition with respect, understanding, and innovation. Autism spectrum disorder, or ASD, is typically characterized by challenges in social interaction, communication, and repetitive behaviors. But these traits are just the tip of the iceberg. Autistic individuals often face co-occurring conditions like anxiety, depression, ADHD, epilepsy, and metabolic disorders such as diabetes and cardiovascular disease. These health challenges significantly contribute to the higher rates of premature mortality that we see in people with autism. So is autism a disorder, a disability, or simply a different way of being? The answer is not simple, and perspectives vary widely. And let me be the first to say, some people get very worked up about this issue. For some, autism is viewed as a disorder, especially in its more severe forms where interventions might be needed to improve communication, social skills, and independence. Some autistic individuals live a life of disability in group homes or living with their parents, unable to take care of themselves. Others see autism as a disability, focusing on creating environments, societal accommodations that can support autistic individuals in schools, workplaces, and throughout society. Others see autism as just a natural variation in human neurobiology, just a different way of being, but equally valuable. This perspective emphasizes strengths like creativity, problem solving, and attention to detail. You know, in DSM-4, we used to separate the diagnosis of autism from what we call the Asperger's disorder. And that actually helped us understand the difference between maybe severe forms of autism and something milder. Many experts in the autism community think that this was a major mistake to remove the diagnosis of Asperger's and lump everybody under one diagnostic category. I have spoken with some parents who are autism advocates who are actually furious about this melding of these categories because some of them have severely autistic children who are not able to live independently, and they feel very strongly that they need medical assistance. You know, all of this talk about autism begs the question, well, what even causes autism? Many will say it's a genetic disorder because autism does run in families. So if you have one or two autistic parents, you're much more likely to have autism yourself. But in fact, genetics does not at all sufficiently explain the development of autism. We know this because we mapped the human genome over 20 years ago, and researchers have been looking tirelessly for the autistic genes, and in fact there are no significant autistic genes. Instead, there are genes that increase risk very ever so slightly, and there are hundreds of them. Now, in fact, we do find genetic differences in about 30% of people with autism, but most of these genetic differences are de novo, meaning they are not mutations or differences inherited from their parents. In fact, it's something that happened probably during neurodevelopment. Other people blame screens, all of the screens that we're putting children in front of. They're not learning social skills as a result. And in fact, we have countless studies finding an association between screen use in early age, infancy and toddlerhood, and the subsequent diagnosis of autism. But in fact, many people will make the counter argument that this is simply a correlation and has nothing to do with causation. And they argue that autistic individuals are more likely to be challenged by social interactions, to not get as much benefit from social interactions. And so they are just driven to want to be in front of a screen instead, to occupy their brains. Some will argue we're just overdiagnosing this. Others will say we're just recognizing it more and appropriately diagnosing it. But in fact, a tremendous amount of science is finally coming together to help us unravel these complex questions about what causes autism. Numerous lines of research are now all suggesting that mitochondrial dysfunction might be at the root of autism-related challenges. You know, as readers of Brain Energy know, mitochondria are much more than powerhouses. They do so many things in terms of the function of cells. They play a role in hormones and neurotransmitters and the way cells develop. And that is particularly important when we talk about neurodevelopment. So that if there are differences in the way mitochondria are functioning during neurodevelopment, there will be differences in neurodevelopment itself. And this actually helps us understand all of the comorbid conditions that can impact people with autism. Things like anxiety, depression, ADHD, and even epilepsy. All of these are very common in autistic individuals. Interestingly, mitochondrial dysfunction also helps us understand why autistic individuals might be more likely to develop metabolic conditions like obesity, diabetes, cardiovascular disease. And it might help us understand why autistic individuals, on average, live shorter lives. You know, how we talk about this, disorder, disability, different, matters. And how we talk about it using language also matters. Some people prefer person-first language, meaning autism is something that someone has. It doesn't define them. So you could say Joe is autistic or Joe has autism. Others actually feel that this is a core part of their identity, and they like identity-first language. So they would say Joe is autistic. Joe is an autistic boy, to simply kind of communicate to people that this is a core part of who he is. There's no universally right answer here. The key is respect and dignity. And so if someone you're talking with prefers one over the other, it's just important to be decent and civil and respectful and honor their preferences. So one of the really important things is that we usually cannot go back in time and redo neurodevelopment. And that means that autistic individuals will likely be different. Once they reach adulthood, they will likely have some fixed traits that are neurodevelopmental in nature for the rest of their life. And there's no way to go back in time and redo that. But thinking about what causes autism and these comorbid conditions can actually help us take care of all of these healthcare needs for these individuals. At the end of the day, it's really about providing holistic care, creating accessible healthcare environments, improving provider training, and tailoring treatments for both mental and physical health needs. Equally important is fostering independence and respecting each individual's unique perspective on autism. Autism is multifaceted. It resists simple labels. The growing research into mitochondrial dysfunction offers hope, not just for better treatments, but for a deeper understanding of how autism connects with all of these co-occurring health conditions. Our goal should be to address these medical challenges while celebrating the diversity of the autistic community. After all, understanding autism means embracing its complexity. As we continue to learn more about autism, let's remember this. Whether autism is seen as a disorder, a disability, or a difference, every individual's perspective matters, and let's just be respectful. By combining cutting-edge science with compassion and respect, we can create a world where everyone thrives. Thanks everyone for watching. If you liked this video, please click the like button. If you know somebody who might benefit from this information, please share this video with them. And if you're interested in the intersection of science, health, metabolism, and human potential, please subscribe to this channel. See you next time. Thanks.